Now we can go to the first task and let us just focus on the home assignment. And here is the text that you worked with at home, which is called, actually this is the text about diabetes. And so Mohammed Nabil is joining us. The text about diabetes, and actually there were a lot of different versions what to use in each gap, and but some of them were like, I don't understand why you suggest to use these phrases. Can you see the screen?
Yes.
And actually, let's try to do like this. And so, and let us try to just to figure out which phrases are missing here. And one more thing I need to focus on. I mean that some of the students just copied the papers of each others and didn't think whether it's right or wrong. So that is why when I saw the identical papers, I just gave 0 for this paper, for this assignment. So, but some students just I see that you've thought about this. Let us just look at the first sentence, and we can see here the first gap. And one more thing, if we have a look at the text, do we understand who is speaking to whom? I mean, is this a patient, for example, or a doctor? Who is speaking? Whose words are there?
Doctor.
Doctor, yes. And who is he talking to?
Talking to patient about the diabetes.
Yes, about diabetes. And he's telling the patient what to do. He's just speaking about diagnosis, and so he's explaining, and he gives instructions to the patients. Because you see, he says, you, I mean that he just tries to explain something to the patient. He uses imperative mood, yes? And so in the first sentence, Dilara, what do you suggest to use in sentence number 1?
Insulin sensitive.
You have what?
You have insulin sensitive.
You have insulin sensitive type 2 diabetes, right?
Right.
Okay, so actually if we use have like the main verb, we don't contract it. You've insulin type, yeah, of diabetes. But this form have shows that we here we have the present perfect form of some other maybe the same or of the verb. So we need to think of a different verb here, not have. What are the other possible just options here? What about the yes, please?
Sees. It will. I suggested like that. It will be this disease maybe causes very weight.
No, I'm speaking about the first one. Instead of have, what is better to use? Because have here is a contracted form, like an auxiliary verb. You have done, or you have written. You
Doctor,
have
been diagnosed with?
Sorry?
Been diagnosed with?
You've been diagnosed type 2 diabetes. Exactly, yes. Or you have developed type 2 diabetes. Yes, so like this. The present perfect should be used. Now, the second sentence, who was speaking about the second sentence? Will you just read it, please? Okay, Bere. Bere.
Yes.
So number 2, please.
This is blah blah. Very overweight. Your body isn't.
Just stop. Blah blah. Very overweight. So what is what should we use instead of the gap here? In the gap. Hmm? Any ideas?
I think.
Mhm.
Uh,
So this is the sentence about the cause and effect. Yes. So
yeah.
the patient has this disease, diabetes, and what is the cause of this illness, of this disease? Overweight. Yes. So if we speak about the cause and effect, what kind of preposition or kind of phrase can be used?
Yes.
If we explain something. So why? Yes, if we answer the question, why? What do we say? What is the first word that we use in explanation of something? What is it? If you ask why, the answer will be, we'll start with the word
Obesity to
because. Yes,
obesity
because you are
very overweight.
Yes.
Your body isn't producing
enough
insulin.
insulin. I mean, number 2, this is because you are overweight. Okay, number 3. So let us listen to Esginur's answer. So what did he write in number 3?
Yes. Blood sugar, you feel so thirsty, and why so pass urine so frequently.
Okay, sugar, blood sugar, you feel.
Blood, yes.
Do you address, are you talking to blood sugar? Or maybe because of the blood sugar, you feel so thirsty. You need to add something because it doesn't make any sense if you just use blood sugar. Tala, what do you suggest to use here?
I think I will put have you feel.
Have you?
Have you feel so thirsty and why you pass urine so frequently?
Maybe
Can
do
I
you
repeat?
feel so thirsty? But it's not a question. This
Do
is
you-
like,
can this is why you feel so thirsty.
exactly. You explain, you give the reason. This is why you feel so thirsty. Okay. So then it's also the reason you have very itchy rash and you have a problem with your eyes. Okay. And the next paragraph, number 4. So, so Jiren.
The nurse feel.
Mhm.
I don't know.
You don't know. So yes, Tala knows. Please, Tala.
I think it will be the nurse will telling your diet,
Will what? Sorry, the nurse will
telling your diet. Tell him, I mean.
tell you about your
Yes.
diet. Okay, the nurse will tell you about your diet, and I will. And number 5, Yahya. Yahya, hello.
Yes,
Yes. So the
and
doctor.
I will be dietitian. I'll be your dietitian.
I'll be your dietitian. Okay. Or I'll just arrange for you to see a dietitian. Yes. Okay.
No, he actually, I think dietitian.
He is a dietitian himself or herself.
Yes,
And I am a but I will what? Will you repeat?
I'll be your.
I'll be your dietitian. Good. So Mustafa, number 6. About tablets. Uh-huh.
Tablets to control your high sugar. I am going to take
Yes,
your tablets.
I'm going to give you tablets to
Tablets.
control your blood sugar. Okay, you don't need insulin right now, but it's possible you might need it in the future. Okay, number 7. Yes, Stella, please. Number 7.
Number 7, it will be you have or you should lose weight.
Your weight. And Stella, number 8. This is one in the same sentence.
And I will see.
Mhm.
And I will see a protectist.
Podiatrist. Podiatrist is a doctor, is the doctor who treats feet. Yes. But
Yes.
Who's going to see a podiatrist? A doctor or his patient?
The doctor.
Patient, of
Patient.
course, patient. And what does the doctor just, does the doctor want the patient to see a podiatrist? Right?
That is him, yes.
Yes, and I want you to see, I want you to see a podiatrist because it's important with diabetes that you take good care of your feet. You should also see your optician every 6 months for eye checks. And diabetes is a serious condition and can affect your heart, blood pressure, circulation, kidneys, and vision, but we can limit these problems by controlling your blood sugar. Okay, no case of diabetes can be described as mild. And number 9, Yosif. Yosif, hello. Mhm.
Yes.
What can we use here? I'll attend diabetic clinic. I think it's similar to number 8. for example.
I will.
Mhm.
I will.
Do you remember what we used in number 8?
Number 8.
Yes.
Well.
No. So you're here.
9. I'll advise you to.
Yes, I'll advise you to attend the diabetic clinic every 2 months. Thank you. So we can check your progress. And number 10, Shema. Shema, hello.
Yes, we might reduce this to 6 months.
Okay, yes, to 6-month visits once your condition is under control. And the final phrase is there. So this is what doctors, teachers ask at the end of the meeting. Everyone
Maybe
asks.
inquires.
Sorry?
Maybe inquires.
Is there any inquiries?
Yes.
Or questions? Yes. Is there? Yes. Is there anything you would like to ask? Something like this? Or are there any questions? Okay. Of course, it's hard to understand what the author of the text means, but some phrases that you've used in your answers that I've seen, I've checked on the Moodle, were they do not suit this context, these sentences. Okay. So anyways, even if they are different from what we've just discussed, we've said, so you've spent some time and just devoted your time and effort to this task, and you thought about this, and So I think this is a like good exercise. And now, okay, I need to like, if I stop, and now I'll share the screen now. And as you see, today we're going to start Unit 7. And the Unit 7 is called Parents and Young Children. And let's try to make it full screen. Can you see the slide full screen?
Yes, teacher.
Okay, and so if we move to the first slide here, there are pictures about children and their parents, and the question: what is happening in each picture? How do the adults and the children interact? So in picture A, Dilara, how can you describe the first picture?
Teacher, we couldn't see anything.
You don't see anything.
Yes, miss.
So let me share one more time. Where is it? Okay.
Yes.
Now you can see, right? So Dilara, please. Hello, Dilara. Dilara left us. So yes.
I think picture A, right?
Yes, picture
They
A.
are trying to get help, maybe.
So who they? Who do you mean? The mother and her child, right?
I'm not sure.
So
I'm not sure the name.
I see.
Ambulance.
Yes.
Ambulance.
It looks like an ambulance. The car. Yes.
Yes.
And they're just running to maybe the hospital just for immediate help.
Yeah.
And so about the interaction between the adult, the mother and her child. So what do they feel, both of them? Who can tell us? What do they feel? Yes?
They are nervous, maybe, and also they are tired.
They're tired, yes.
And
nervous.
fearing.
Yes, and they are scared because of the child's condition. We don't know exactly about his condition, but some kind of serious condition because the emergency has come. Okay. Yes, and mother just tries to ease the child to help him to relax. Yes, like this. Okay, and in picture B, so let us focus on picture B and listen to Bere. What can you see in the picture, Bere?
Yes.
Where are the people? Who are they?
Hospital.
Okay. And who are the people?
To chat people. To chat.
So a child is sitting, a girl is sitting on the bed. Yes.
Yes.
So are you sure that this is a hospital or are they at home?
About the children's healthy to chat, I think.
Doctor, can I add something?
Yes, please.
I think it will be a doctor who takes care from sick children And I think it will be also ask them about something or check their health.
Mhm, mhm. Yes, and the doctor, actually, he's not wearing the white coat, just not to, maybe even not to scare the child, but he's
Or
talking.
maybe he is advised.
Sorry, will you repeat, please?
Maybe he is not his job is not a doctor. Maybe he will be advised for the doctor for
Consultant.
the children.
Mhm.
Doctor, maybe the boy have some psychological problem.
Psychological problem. Okay, maybe, but as far as I can see here, the girl has the problem with her hand.
Maybe
So-
they in house.
Yes, it looks like they're in their house because of the furniture and so the toys, the books, and just what is tablet or computer. Maybe they're at home and the doctor just talks to the parents, just gives them advice about the condition of their child. So and also in this picture, the parents just are worried about their child. And if we move to the next picture, so picture C, and let us listen to Jeren. Jeren, what can you see in picture C?
There is a nurse and a patient.
Uh-huh. And what is the nurse
Nurse,
doing?
she's doing an injection.
Mm-hmm. And how does the boy feel?
Upset, feel, and scared.
Scared, yes. Mhm, mhm. So both mother and nurse just are trying
It's
to,
vaccine.
yes, vaccination, trying to comfort him, but he's just so scared that he's crying. Okay, and so picture D, Yahya, what is there in picture D?
So I think there are patient and the nurse read his report to give him the medicine.
And where are the people? Are they in the hospital or at home?
I think they are in the hospital.
Mhm, mhm. So she reads instructions to the boy's father, right? Or mother, I don't know. So, okay. Yes, so just to help the patient, just he gives instructions what to do, for how to treat the patient. Okay. And the last picture, E here. So yes, Dala, please.
About this picture, it will be, I think, he is the person from the patient's family, and he is look like that he is very afraid and worried about him.
Mm-hmm, mm-hmm. Yes. And so this boy is in coma, and it's, yes, Yosif?
And the patient, he's asleep or unconscious, and he is maybe he will die maybe.
Yes, he is in very serious condition. And just his father, I think, is sitting next to his bed, like just in case when the child wakes up. So he will see his father, just not to be scared of the hospital and everything around him. Okay, I mean that the support of parents for children is very important, especially when they are in the hospital, when they have problems with health, when they feel some kind of pain. Okay, and if we move here, so the question here, the environment for treating children needs to be made different from that for treating adults. Why and how? So, and what does it include? Environment. Environment is like the ward, the office where the children are, and where the children meet the doctor, or the people they deal with. So why, like, yes, Mohammed, please.
Yeah, because to make them more comfortable about the situation.
And how? Mhm.
Yeah, to give him to make the walls have a lot of colors, for example.
Uh-huh.
Also, give them some toys, for example. Also, yeah,
Mhm.
something like that. And also the way that the doctor talking with it. But I think it's not about the environment.
Uh-huh. Yes, so some physical environment, the place where they meet the doctor. Uh-huh. Okay. And so Yosef and who? Second person. Only Yosef. Okay.
Can I?
Yes, please. Uh-huh.
So that children do not feel terrified and afraid, and that their psychological condition is good and stable.
Mm-hmm. Yes, it's very important. Yeah. Mm-hmm.
Sorry, doctor, but you write me absent or
Who? Your name?
Mohammed Nabil?
Sorry?
Mohammed Nabil.
Yes. Uh-huh. Mm-hmm. Yes, I corrected this. Mm-hmm. Okay, so we understand how the environment should be different for children in the hospital. And there is some information, some statistics about patients who are less than 15 years of age make up 20% of the average general practice, GP practice in the United Kingdom. So 20%. And there are those children who are under 4 years old, under 4 patients consult their GP more than any other age group except the elderly. So very often. And the question, is this pattern the same in your own country? I mean that, so a lot of just work for pediatricians because a lot of young babies, young children just go visit the doctors. Is the situation the same in your country? Let's listen to Mustafa.
Yes, doctor.
Your country, what country you are from?
I'm from Egypt.
Egypt. So is the situation the same in Egypt? What do you think?
Yes.
Of course, we don't know the exact statistics, but have you ever been to a hospital? Have you seen the patients? And I think you were some kind of interested in the situation with the age groups who normally go to visit the doctors. Is the situation the same in Egypt?
Yes, but I actually I can't understand the question.
You don't understand the question. So
Mm.
I mean that among the patients who visit the doctors in the hospitals, in their clinics, 20% are young children or teenagers, less than 15 years of age. And there are a lot of just little babies under 4 years old. So, and the question, is the situation the same in your own country? I mean that a lot of children visit doctors and have problems with their health. Who can answer this question?
Can I, Doctor?
Yes, your name is
Tala.
Tala, please.
I think yes, because they are the beginning of their lives, and so parents, that is why there are a stage of growth to babies and development, of course, on their health and to grow up. And the mother and fathers, it will be made fair for that reason. This will affect their health in the future.
Exactly. It's very important to take care of their health from the beginning. Yes. Great. And so you mean that, Tala, what is your country? Where are you now?
My country is Jordan.
Jordan. Okay. So, and yes, Yosif, please.
Yes, doctor. I think it is yes, because most pediatric patients are of parents who are very attentive to their children and are very careful about their health.
Yes, yes, because not the children themselves visit doctors, but their parents and just
Yes.
bring them to the doctors. Okay, yes. What about Turkey, Dilara? Dilara?
Yes. Yes. I'm not sure, but it could be because they get sick very quickly.
Yes, especially when they start going to school or kindergarten. Yes.
Yes, yes.
Okay, so it looks like we have less than 1 minute. Let us